Hello, my name is Edith Williams, and I am the founding director of the Office of Health Equity Research at the University of Rochester Medical Center. And I am very happy to be with you today to discuss how we ensure diversity, equity, and inclusion in health research. So, why the charge to ensure diversity? Why is this so important? Well, we know that communities of color predominantly share the greatest burden of chronic and otherwise adverse outcomes in our country. And we also know that historically, members of the most impacted groups have been absent from the research conducted to develop treatments and approaches to reduce the burden of these same ills. And there are a number of reasons for this. Communities of color have been intentionally excluded in some instances. In other instances, there has been unintentional oversight of such communities. And we are all aware of the medical misconduct and atrocities that have occurred, like the father of gynecology, James Marion Sims, and Tuskegee, that have caused communities of color not to trust the medical enterprise or biomedical research. And I can't sit here and tell you that there is no way disgusting inhumanities like this could ever happen again. But I can let you know that there are protections in place now that make it very difficult, and I would venture to say near impossible for investigators to mistreat research participants. Our proposals and research practices are scrutinized, and we have to prove that what we want to do or what we want to study is necessary, that we are maximizing benefit, and that we're minimizing even the potential of harm to be able to recruit and conduct research with even one person. So, what can we as investigators do to ensure diversity in the research that we're conducting? Well, first of all, we need to understand this resistance to participate and the low numbers that we're seeing. We need to understand that there is this pervasive lack of trust among communities of color. We also need to understand that we are not doing a very good job getting the word out about opportunities to participate in research. And we have to consider context. We often are offering opportunities to participate in research that mean people have to travel far distances, that they have to invest a lot of time, possibly taking time off of work, that we are asking people to take time away from their families when they may not have care for small children and elders. And it's important that we understand those contextual circumstances about the people that we are asking to give of themselves in this way, because it is a sacrifice and it is something voluntary, whether you're being incentivized or not. It is definitely a voluntary choice to participate in research. We also have a lack of information. People may not have received information about opportunities to participate in research, and they may not understand all the facts and information about a given study. We understand as investigators that trials, particularly clinical trials, can be very tricky, and eligibility can sometimes not be straightforward. Sometimes trials are very specific in who they want to recruit and different things that must be present and other exclusion criteria, things that can't be present. And so sometimes it can be difficult to find people who match up with very specific inclusion and exclusion criteria. And it's important that people are aware of that and don't feel that they're being excluded in an unfair or unjust way. And understand why they are being asked to participate in a given study because of the specificity of different inclusion and exclusion criteria. And we can accomplish these things or overcome these things like lack of information, lack of trust, with better outreach, communicating opportunities. We need to be present. We need to be there, and we need to be in our communities and be present before and ask. Before we're trying to recruit 100 diverse people into a study, We need to be present. We need to understand our community's lives, what matters to our neighbors and our colleagues and our friends. We need to have authentic communication with our community, our fellow community members, about different opportunities. And like I said, not just when an ask is coming about, not just when we have a research study that we're recruiting for. We need to have these types of authentic conversations when we're developing our research studies. Where should our priorities be? What type of recruitment is feasible? What's going to make sense? What's going to be valued? What's going to mean something, be meaningful to our fellow community members? If we can have those types of conversations and build better research programs, really build that type of communication into the design of our studies, then we have a better chance of involving the very people that we're trying to reach. But we need to be present, and we need to be ready to authentically communicate with our neighbors. And when we're authentically communicating, we are being transparent. We're being direct about our intentions, about our goals. And we're not trying to skirt around issues. We're not trying to hide various facts about a given study or the implications for a study. We are being very transparent and open, and we are inviting others to engage with us, to ask us questions, to search together for solutions and compromises and how we can best engage. So that's, again, where that authentic communication comes into play, and being transparent in that way. And then we need to make the case for the relevance of what we're doing. Why should this be important? We can share personal stories. We can interact with those who have already participated and encourage them to interact with others and to share their personal stories, to make those connections of relevance of what is being studied. A lot of times that's what's missing. Why should this be important to me? What does this matter to me in my life, in the lives of my family and my neighbors, other people who are important to me? So it's making those connections that could be vital in encouraging people to participate in health research. So we talked about what investigators can do. What can we, members of communities of color, do? First of all, we don't have to wait for the opportunities to be brought to us to participate in health research. We can find opportunities ourselves through resources like clinicaltrials.gov, where you can peruse trials that are already going on by location, by topic. And you don't always have to have a disease or the disease under study. If there is something you're passionate about, maybe you had a family member who suffered through a condition and you want to help that cause, look up opportunities to be part of studies addressing that disease or that condition. A lot of times studies are looking for healthy controls to participate, and that can be just as important a role as the participation of someone who is suffering with that illness or condition. Personally, my family benefits from and participates in research regularly. My mother had a stroke this past December, and I want to know that the imaging machines, the medications that are administered, even the rehabilitative physical therapy that she's receiving has not only been tested on old white men, but that they've been shown to be safe and effective for a frail 70-year-old Black woman like my mom. And my son has eczema and has persistent and really severe flares. And at his last appointment with his dermatologist, they recommended that we try a new treatment. And his dermatologist was able to assure me that this new treatment has been tested in small children like my 2-year-old son, and point me to the articles detailing the trials that had been run and the populations involved and their outcomes, to give me assurance as a mother, choose being informed about my choice of treatment for my son. And my 15-year-old daughter has been participating in a brain imaging study since she was 11. And in addition to brain scans every year, she's asked a battery of questions about decisions she's making and behavior she's engaging in. And then they correlate her responses with her brain development. And her lived experience and subsequent decisions may look very different from other teens. And I would hate for her development to be defined by experiences that aren't her own. All of us have been touched in some way by illness, and it will take all of us to ensure that the medicines, the interventions, the treatment approaches are the best fit and the most appropriate for those who need them. So let's do this together. Thank you.